So we have a whole host of absolutely incredible people to help our families and the child through this. Hospital school, I can't say enough about. They're an integral part of our team. You know, we're a firm believer in treating children like normal, they'll act like normal. We expect our kids to graduate high school with their class and not be left behind. Our recreational therapists are incredibly talented, educated, and trained people that help with relaxation techniques, help children get through difficult procedures with great ease, help the children and their families relax while they're going through therapies, and are an incredible support system to our families. They've helped develop our support groups for adolescents, for siblings of childhood cancer patients, and for bereavement as well. Social work and psychology, again, I can't speak enough of. And every one of our families sees all of these people, and it's integral to their treatment, and we wouldn't treat anybody without having all those resources. Within our division, we have pediatric bone marrow transplant, which really has been an evolving field. It's not for every disorder, it's not for every patient, but when used appropriately and for the specific diseases that it works for, it's really a life-saving measure. It's very complex, needless to say. It takes a lot of people to care for children with bone marrow transplant. We have 2 physicians that are dedicated to pediatric bone marrow transplant and only pediatric bone marrow transplant. They have a nurse practitioner, and we have a coordinator that works with them as well. So it's a very concentrated, very important part of our team. While we're educating them about their childhood cancer and what their child might be going through, we discuss clinical trials as well. That's probably the second hardest thing we have to do, because trying to talk to a family about what a clinical trial is and randomize clinical trials that half the children may get one treatment, half the other children may get another treatment, and that both treatments are good, and we're just trying to compare and contrast efficacy of treatment as well as side effects, that we don't use placebos, that their children aren't guinea pigs, and most importantly, they never have to participate in a clinical trial. That we think it's a good way to go, that no one will be upset with them if they don't do that. They'll still get the best care possible. But with clinical trials, there's a lot to be learned, not only just for that patient, but for other families that will be going through the same issues in the future. So most of our families actually take great comfort in being in a clinical trial. One, knowing that they're not only getting our expertise here at UNC, but they're getting the expertise of many oncologists who have put a lot of thought and energy into these clinical trials. So basically, you're getting a second opinion from many different people when you're in a clinical trial. The advances in childhood cancer, its treatment, its diagnosis has really improved dramatically over the years. When I first started doing this business, we lost most children to their disorder. Now we cure over 80% of children with cancer. That comes from bench research, that comes from clinical trials like Children's Oncology Group. I think the future holds a lot. Our supportive care has gotten so much better, so better antibiotics, better blood products, better radiation therapy. When we try to cure a child with cancer, we have a lot of goals, and it might sound weird, but sometimes curing that child isn't the #1 goal, or isn't the only #1 goal. It's curing them with a normal lifestyle as well, a normal quality of life. So we have to be very careful. Treating a child with cancer is very different than treating an adult with cancer. So using radiation therapy, we have to be very careful with, depending on where the radiation is going and how it might affect the child, both short-term and long-term. UNC has a system that automatically is set up, and so we make sure that the referring pediatrician's name is in the system. So anytime we do a note, as soon as that is signed, it's faxed to the referring physician that same day. And that helps a lot, and that's when they're inpatient as well. We try to call our families a lot, and actually we give referring physicians our phone numbers so they have direct contact with us as well. And there's a referral line at UNC for people to call in as well. We also try to do a lot of outreach. We have a clinic in Raleigh, we have a clinic in Wilmington, and so we go to those, and we also go around and give grand rounds in different cities and stuff to try to stay in communication with the referring population. Kids are, they're raw, they're real, what you see is what you get. And so learning how to deal with them and help them cope with what they're going through, and their parents as well, is just truly a great blessing and something I'm very fortunate to have.